In a previous video, I talked to you about your back pain and how the psoas muscle, which attaches to the lumbar region of the spine, down onto the inside of the thigh bone, how tightness in that muscle causes an anterior tilt to the pelvis, loading that lower back and causing the pain. So today I'm going to talk to you about another couple of muscles which will go into that system to try and reduce your pain. So the first one are the hamstrings. Now the hamstrings are attached to the sit bone and they come down the back of the leg here. So when these are weak, they don't pull down on the back of the pelvis, which would normally get you into a posterior tilt. If they're weak, they don't counteract that psoas tightness and you maintain that anterior tilt to the pelvis. On top of that, we're going to talk about the abdominal muscles and how they work. So the abdominal muscles, there are different ones obviously, but in general, they sort of attach around the rib cage, down onto the hips and across the front into the inguinal ligament here. And so when these are tight and working hard, they obviously pull up on the front of the pelvis and again go into that posterior tilt. So when they're not working, they don't counteract the psoas muscle, etc. And also the rectus femoris, which comes down the front of the thigh, that attaching here to the ASIS, or the anterior superior iliac spine, which when tight pulls you down. So you don't get that counterplay between anterior and posterior tilt, i.e. sitting in a neutral. So today's exercise are basically to activate the abdominal muscles and activate the hamstrings. And so what you're going to need is a chair, a block and the floor. So here we are, I've got the chair, I've got my block and I've got the floor. Here's the exercise. Lie on your back and place your feet up onto the chair. Now, if that's a 90-degree angle with my legs, I'm going to extend it out a little bit so I'm now at 60 rather than 90. Yeah? The block I'm going to place in between my thighs and gently squeeze it together. Then my heels are going to pull down into the chair. Now you can see as I pull the heels down, it just tilts my pelvis off, lifts my sit bone off, or tailbone rather, off the floor. And you'll find that the bum is nice and soft, so the glutes haven't been activated. However, the back of my thighs have gone hard. That's my hamstrings and they are activating. So one of the things we're trying to do, tick. So a gentle pull down of the heels, a squeeze in of the thighs. Then I want you to stretch your arms up towards your knees, again about this 60-degree angle. And you'll find that's already started to work your abs just a touch. Then the head stays resting on the floor, you take a deep breath in, and you exhale through an open mouth to bring the rib cage down. Now, hold the rib cage down, inhale through the nose, and repeat. You should find that muscles here, these are the internal obliques really, you should find that not burning, but you can feel them working certainly. And I want you to do that 6 breaths, give yourself a rest in between, do it 3 times, and then do it in the morning and do it in the evening. And do it for a week. See how your back pain progresses. Hopefully it gets easier. If it doesn't, then you need some help. Book yourself an appointment with me if you're close by, or with your local therapist if not, and see what we can see, and maybe we can turn the corner for you and get you out of pain. Many people think that that pain is normal and that's what you should feel. Well, I can tell you from first-hand experience, not everybody is in pain. I'm not. So there we are. So if you've enjoyed this video, give it a like and also subscribe to my channel. It really helps me produce these bits and pieces for you. And I hope to see you in the next one. Thanks very much.